Good afternoon, everyone. Thanks for your patience. I'm going to give a couple more seconds here and do a little fill in of the airtime as folks get connected with Zoom. We want to welcome everyone here this afternoon. It's good to see all of you. And what we're going to do, my name's Nuto Haynes. I am the facilitator for the partnership. Welcome to our December meeting. We're still kind of putting together some of our technical pieces. So if you don't mind, I will go through a couple different announcements real quick before we get started. For folks to know that we are trying to get closed captioning available on this particular meeting today. If you haven't already seen that happening, we're looking to see that there's a CC button at the bottom of your screen. And then it was also put in the chat. A link is in the chat so that you might want to open up that link if you need closed caption today. We will also have Spanish interpretation. And what I'm going to do now is pause so that our interpreter can make this announcement in Spanish.
Sí, ¿qué tal? Buenas tardes. Así que para la sesión de hoy día vamos a estar proporcionando servicios de intérprete para español. Por favor, procuren seleccionar en la barra inferior en cuanto aparezca el icono del globo terráqueo su idioma de preferencia. En este caso las opciones serán inglés y español. Para español seleccionen español. Tienen que sí o sí elegir un canal, si no, no van a escuchar nada. Muchas gracias.
Thank you, Mark. I believe you can select the Spanish or English channel at the bottom of your toolbar. Is that correct, Heather? Christy?
Yep, I'm turning it on right now.
Oh, super. So at the bottom of your toolbar, you can select either English or Spanish. So I personally will be selecting English today. So go ahead and select that particular one. And then in the chat, we have, you want to make sure you switch to the Spanish station. And so again, select that one if you want to hear in Spanish today. We also want to make mention that today's meeting, there's not going to be any public comment period. So members of the public, we're glad that you're here and that you're able to be in listen only mode today. But you can comment in the chat or email publichealth.policy@state.or.us. Our staff at OHA will be looking at all those emails, and then we will share all of those public comments back to the partnership as we compile all of that. So welcome, but we will not be having open public comment period today in today's meeting. What we'll do right now is before we get started, I wanted to give folks an opportunity to review the agenda real quick if we haven't already done so. We're going to be doing kind of a quick welcome this morning, this afternoon, some team building. We'll have a report out from our guidance committee. And if you recall, we're a guidance committee of 4 or 5 folks from the partnership. And then we'll also have some special guests today from the director's office. We have Kara Biddlecom and then Karina Walker, who will be sharing some legislative concepts for 2023. We'll take a break in between all of that and then come back and talk about reaching consensus on the focus strategies for the upcoming year, 2022. We'll also do a little bit of development work plan for the upcoming year. And then we'll do a quick member update, see if anybody wants to share any quick highlights of work that's been happening in the field since we last met in November. And then we'll wrap it up. We aim to complete everything by 3 o'clock today, if not a little earlier. Do folks have any additional agenda items that they wanted to bring forward at this time, or any questions?
I've got one request. We've got
Please.
quite a number of people from the public. So especially if you are a partnership member and you've called in on a phone, or that your name is not clear in the attendees list, if you could rename yourself, just so we can keep track of partnership members as we move you into breakout rooms and the like. Thank you.
Great, thank you. So again, we want to welcome everyone. You know, it's been a very long month, I feel, a very long month. I know the last week or so, there's just been a lot of heavy news happening in and around our nation, in and around our community. We wanted to take some time this afternoon to really give ourselves some space to connect with one another during this time and during this season. So the first thing that we're going to be doing is really coming together to do a warm-up exercise. And so our warm-up exercise today, we're going to group you up into breakout rooms of 3 to 4 folks, different partnership folks. And we'll have 2 questions for you, and you can answer one or the other. You don't have to answer both. The first question would be, if you could have one person join you at dinner today, individual, whether they're dead or alive, who would that be? Or what is one thing you are looking forward to in 2022? So one of those 2 questions as our warm-up. We do hope that you get the time to just spend getting to know one another as part of this team. So Christy, when you're ready, we're going to break up. We'll have about 5 to 10 minutes to do this portion. So introduce yourselves if you haven't got a chance to talk with these specific partnership members before, and answer either of these questions.
All right, here we go.
See you in a bit. All right. Are folks back? Or they still have one more minute?
24 seconds.
Okay. I don't have that information here.
Hi, this is Kurt. Can you hear me?
Hi, Kurt. Yes, we can hear you. Thank you.
Okay. I'm going to mute. I'm calling in on my cell phone.
Okay. Welcome back, everybody. It's always good to see people all popping in with smiles on their faces. That means that means the time spent was good, or at the very least humorous for some of you. We want to welcome everybody back. You know, it's always good to be with this group. We do have a pretty full agenda, and we want to give you the space and time to hear from one another. And so what I'm going to do is go ahead and welcome you all back in this space. Again, we're going to have our guidance committee report out. In our guidance committee, we have 2 folks who step forward to share information with you about what was being worked on in this last month. And I'm going to start with Alicia and then go to Connie. So Alicia, you have the floor.
Hi. Okay, so let me get my notes up real quick. So I'm reporting out on 2 of the points that we're talking about. Okay, so I'm reporting out on the root cause analysis or follow-up from the November meeting, and the need to identify new members and a process for ongoing membership. So in terms of the need to identify, we came up with a few points here. So we've identified that there's a need to identify new members, because we're down 2 members due to that we've lost due to job transitions. So we have to figure out a way to get to at least 2 new members back onto the partnership. And then also we need to identify a process for ongoing membership retention. So OHA had identified the initial membership, but would like us to inform how membership is identified moving forward. So how do we recruit new members, and what is, as a need arises due to job transitions or challenges, to time commitment. Now the idea here is that this can be either the work of the guidance committee or a new kind of membership specific committee. And from my understanding, we'll be talking about that later on in the meeting. So I got my little 3-year-old, almost 4-year-old running in the background. Then we discussed the root cause analysis. So at the last month's meeting, there was a proposal that we consider conducting a root cause analysis to help determine what strategies we want to focus on next year. However, after discussing the root cause analysis, and then upon I believe Christy did some research on it. I've done one before in college, so I kind of figured I knew the amount of work that comes with it. However, so we discussed it and determined that it's a very intensive exercise that should have happened during the development of the plan itself. So therefore, during root cause analysis, now would be kind of like starting all over again. And we didn't think that was the intention of, what else do we have? Now, although a formal root cause analysis wasn't used to develop the HTO, the partnership and subcommittee committees used a number of different tools to arrive at the plan. And this included quantitative and qualitative data, other strategic plans, and then already established criteria. Really? So the guidance committee determined that we could use a similar process or similar approach instead of the root cause analysis. And that's which should be feasible in identifying kind of chunks of strategies that the partnership will work on. And we could utilize data that's already collected via the state health assessment, using data that's already collected through community health assessments, including coordinated care organizations, nonprofit hospitals, local public health authorities, and then other resources like nonprofits, community meetings, and so on. Another option could be potentially examining various admissions that are brought to systems of care. So the idea is kind of centering communities around the strategies that we will identify in chunks, in addition to all the other data that that we know we have to take into consideration. It's items that are related to legislative processes and stuff. So that's what I have.
Thank you, Alicia. Why don't we have Connie go and then take questions from partnership folks, if you have any for the guidance committee. Connie, do you want to go ahead? You're on mute, Connie.
How did that happen? Usually it says I'm going to do this first to get this business out of the way as far as changing our name to the guidance committee. There's a partnership committee already with well, it's a steering committee or partnership with the partnership, the HTO. So we didn't want to add confusion to our other duties that we're doing. So it was discussed to make it the guidance committee, which we will be doing. We're going to meet in January at a retreat, and we're going to be discussing things that we want to work on in 2022. I see that I'm going to be talking more about the Oregon Food Bank that I went to. I attended that conference for the Community Food Systems Network. We're going to be talking more about that. We're also going to be speaking. I really don't want to speak too much on our 7 strategies because sometimes it gets redundant and we keep saying the same things and people get confused. So I'm just going to say that we, the guidance committee, have thought a lot about food insecurities, and that's why I have interesting data on seeding and where you can get stuff and what they're called suicide plants now. Did you know that? That's what they're called. The ones that you use once and then they're no good anymore. That was a term I heard on the radio. So we're going to be talking about seeds, where to get them, how to sustain things like that, which is part of the 7 strategies. And that's all I have to say. Any questions?
Do
Hi,
partnerships?
this is Kurt.
Go ahead,
Hi, Kurt.
Kurt.
Hi there. I appreciate all the hard work and research into the root cause analysis, and I support the recommendations to move forward. I think that's great, and I appreciate, again, all the hard work everybody did.
Thank you.
Thank
We
you.
appreciate you.
Do other folks have questions for our guidance committee? The guidance committee, again, is made up of Connie, Alicia, Stan. Susan will be joining us in January, and then Esther. And they will be joining us at 2 o'clock, Esther will. And then any questions about specifically that need to identify new members in the process for ongoing membership? The guidance committee was definitely wanting to give that as an opportunity to other folks on this group of 20 plus to join in on the recruitment process or ideas. Since these 4 or 5 folks have stepped up to kind of help guide some of the future work. If folks feel like, 2022 has some space for additional work on this group, that might be an area that we would welcome somebody to step forward, or a couple people to step forward to help think through what would that look like to bring on new members. And then also, how do we continue to sustain and support those folks who are currently on the partnership so that people feel engaged and stay engaged, right? And then a quick note about the retreat that Connie mentioned. This group of folks have decided that, January would be a really good time. We will be taking a break as a group, not meeting in January. And so, but this group of your colleagues will be getting together to do what tentatively is a half-day retreat on really looking forward to 2022 and doing some mapping of high-level information that we can get started on for the next year. Any thoughts or comments? Anybody itching to join folks at the retreat? I know that was an open invitation, really. So
I think it would be great if they came. Everybody has an idea. We'd like to hear them.
All right. So if you have any questions about that, please don't hesitate to reach out to Christy, myself, or anyone else on the guidance committee. Thank you, guidance committee, for all that hard work in November that you will continue to do as you help this group continue in its process for the upcoming year. What we're going to do now is go ahead and switch gears and move right into our OHA 2023 legislative concepts. And we want to welcome Kara Biddlecom, our Deputy Director. I'm not sure if she's on just yet, but we also have Karina Walker, who is our Legislative Policy Lead. And so up there, I see Kara. Thank you. So I'm going to turn it over to both Kara and Karina. And if you want to introduce yourselves, that would be awesome too. Thank you.
Thank you. Hi, everyone. I am Sharina Walker. I am the Legislative Policy Lead for the Public Health Division. I'm pretty new to my role. I'm excited to be here today. I actually see some familiar faces. Before this role, I was on the community engagement team, on Dolly's community engagement team. And so it's nice to see some of you. I will pass it over to Kara for her to introduce herself.
Hi, good afternoon, everybody. Kara Biddlecom, she, her, and hers. I think Sharina is going to take the lead on the presentation this afternoon, and happy to have a dialogue and start to engage with you all on thinking in preparation for the 2023 legislative session.
Thanks, Kara. I think we can go to the next slide. All right, so we put together some slides. We're going to have a conversation like Kara mentioned. So talk a little bit about the role of OHA Public Health Division in the legislative process, so the role and then the actual process, legislative process, different ways ideas become laws. I'm going to give some examples, and then hopefully we'll have plenty of time for discussion and questions. Thanks. So this slide just kind of goes over the role of OHA in the legislative process. And so some of the things that OHA does is support the governor's policy and budget positions, evaluate proposed legislation for policy fiscal impact on OHA programs and operations. They provide objective and fact-based information, identify and address health equity and anti-racism issues and proposed legislation. Another thing is advanced policy that supports Healthier Together Oregon. I'm happy to talk with you all a little bit more about that today. Advance the 10-year strategic goal of eliminating health inequities, and identify policy that supports the triple aim, which is better healthcare, better cost, lower cost. And I think something that might not be explicitly drawn out in this slide is that engaging community through this process and making sure that the process is community centered is something that we're really working towards, and we're currently identifying ways to make that better and more inclusive for the next session and beyond. All right, so a little bit about legislative session. So there's a long session and a short session. So the long session is 160 days and odd number years. So we just finished a long session in 2021. Our next one will be in 2023. And then the short session is 35 days and even numbered years. So that's what's coming up in 2022. And we don't typically put together or put forward legislative concepts and policy option packages for the short session. That's usually for the long session. And as you'll see as I go through the process, the long session, there's quite a bit of planning that goes along with that. And so we're currently working on that long session now. It seems like it's really far in the future, but it takes some time and to be intentional and put together equity-centered concepts and policy option packages is a lot of work. And so I'll go through that in the next slide. Great. So this is part of the timeline for the 2023 legislative session and process. And so I put here at the top, like, really engaging partners throughout the process and identifying, developing, and refining legislative concepts and policy option packages. So this is something that really should be a part of most of these steps and throughout, instead of going back to community at the end and being like, oh, here's what we developed. What do you think? It's rather, you know, how are we putting forward ideas that are really coming from community? And so right now, and we're in December 2021. And so right now, those concepts are really being identified, thought through. An initial list of topics and ideas will be put forward, kind of internally, begin drafting those concepts and packages. And then in February, a draft of those concepts and packages will go to leaders. And then March 2022, finalize legislative concepts and policy option packages, because those are due to DAS in April of 2022. And next slide. And then May through June, DAS and the governor's office review those legislative concepts. And then June through January 2023, those are really discussed and refined with partners as needed. And so it goes through a lot of layers of review and refinement, which will include community partners along the way. And then August through October 2022, this is when we prepare one-pager summaries and fiscal impact estimates. And then January 2023 is when the session starts. So as you can see, there's a lot of stuff that happens, a lot of layers, and it takes a while. So we're getting started now. Next slide. And then obviously, you know, state agencies are not the only way that you can put an idea forward to become a law. So you can also, as a citizen or a group, present something to an idea or concept to a representative, and then the representative decides to sponsor and introduce the bill. So that's another way, and then the process is started. And I think the next slide is it's a graphic. I know not everyone loves, like sometimes people look at these things and it just kind of makes their head explode. I'm kind of one of those people, but then it's also kind of helpful too. I actually pulled this from OLIS. It's just a diagram that they have about the legislative process. And so it's just a little bit of a path. So I'm not going to read the whole thing to you, but it just kind of gives you an idea of, you know, just the path that it goes through. Concerned citizen or group suggests an idea for legislation that goes to a committee, legislator or legislative committee sponsors bill. Bill is drafted by legislative council, and it just goes on. I'm not gonna bore you with all these details, but if it's helpful, yeah, Christy, I think, yeah, I can stick the link into the chat when I'm done with this, or maybe Kara can do it, but yeah, because they also have really good information too on their website about the process. It is a little jargony, and sometimes it feels like you need to have a law degree to understand what they're talking about, but it is helpful. They have lots of information on their site. All right, next slide. Thank you. And then we have the administrative rulemaking process. And this is, I don't want to spend too much time on this, but I just wanted to point out too that there's also community engagement opportunities with the rulemaking process. And so you can be a part of a rules advisory committee. In fact, it's required to include representation of communities most impacted by the rule in the committee. And then there's opportunities to comment. And so this is a part of the process I just wanted to point out. Next slide. Thanks. And this is just, I know there's a lot of words on here. This is an example of OHA bills from the 2021 session that ended not too long ago. And so there's the Regional Health Equity Coalition's Senate Bill 70. And so that's an example of something that went through And then there's the Cover All People House Bill 3352, which provides Medicaid coverage to adults, to all adults regardless of immigration status. And then Tribal Traditional Health Workers, House Bill 2088 establishes Tribal Traditional Health Worker category within Traditional Health Worker Program. And then there's a Behavioral Health Workforce Diversity Bill. I don't know if I don't want to necessarily just bore you by reading these slides, but these are some examples of from some bills from the 2021 session that really works to move forward equity center community, and really aligns with, I think, Healthier Together Oregon as well. Next slide. All right, and so some OHA bills from the 21 session. So these are general Public Health Division general fund legislative investments. And so the Public Health Modernization, that was an additional 45 million. Many of you may be familiar with that. So this really enhances investments in health equity, community partnership development, emergency preparedness, environmental health, and communicable disease control through new positions and contracts within the Public Health Division. And it also increases investments to local public health authorities and tribes, and new investments in community-based organizations. Some of you may have seen the announcement that went out last week for community-based organizations to apply for grant funding for the public health modernization work, which is super exciting. And then there's the universally offered home visiting, which is an additional $4.6 million in general funds, and then an additional, there's $3.2 million in federal funds. And this continues and expands implementation of the universally offered postnatal nurse home visiting program. And then there's the Healthy Homes program, which is $10 million. And that establishes the statewide Healthy Homes program to allow low-income households and landlords grant funds for radon, lead, mold, and mildew abatement and other repairs to prevent environmental health hazards in homes. And then there's the psilocybin services, which is the startup of the psilocybin services program that was established through ballot measure 109. Okay, next slide. And then just some more examples of other state agency bills from the 2021 session. Again, I probably don't want to read all of this that's in the slide, but there's implicit and racial bias training, which was House Bill 2007, requires implicit and racial bias training for applicants for a mortgage loan. License, the Racial Justice Council was established. Let's see here. Homeowner for BIPOC and tribal communities, Senate Bill 79 provides grants and technical assistance to organizations that support homeownership among people of color and tribal communities. So there's just a lot of examples here that I think really tie in nicely with Healthier Together Oregon in impacting equity across Oregon. Next slide. So I kind of went through that kind of fast. I want to see if anyone has any questions. And then we also have questions here that we're hoping to have a discussion. And the first one is around, have you or your agency or your coalition been involved with policymaking in the past? Oh, Jess, you have your hand up. I'm going to go to you and stop talking.
Thank you. Jess, OMCA. Really excited about all these grant opportunities and whatnot. How do we get the information on these things? I mean, we don't, here at OMCA, we didn't know that there was a grant for public health modernization, $4 to $5 million, or the Healthy Homes program. And these are a lot of things that the Marshall Legion and the Island communities are like a focus on. So how do we get more information about these?
Yeah, well, I know an email went out about the public health modernization funding last week. I don't know if Kara, maybe we can double check and see if you were on that listserv. That didn't just go out internally, did it? That actually went out to community partners?
Yes. So, hi, Jess, this is Kara. A couple of things. So, because some of these investments have not yet been made. So for that public health modernization piece, that 45 million is a total amount of money for community-based organizations, tribal health departments, local public health authorities, and OHA together. However, just on Friday was when we released that request for grant applications for community-based organizations. It's also bundled with several other funding streams so that there's just one application and then each organization can apply for as many as they would like to within it. Christy, I'm wondering if we can make sure that we get that out to the partnership. We also sent it out to our community-based organizations, and any organization that's registered in Oregon BIS should have been able to get it. But then there's also a website where you can sign up, and we'll keep sending the updates on it. So hopefully you're covered there. On the Healthy Homes initiative, so that one did not become law until 91 days after the session adjourned, which was just at the end of September. So I believe right now where that program is at is they are establishing an advisory committee that will sort of advise on how the investments are made in the Healthy Homes program. And then they'll start to be getting those grant funds out. They haven't been released yet, but when they do, we can just keep making sure that we're, of course, sending it to community-based organizations, to the partnership, and kind of in our other places as well.
And Kara, this is Liz. I just I did post the link to it, the modernization funding opportunity, in the chat, and then I did post it on the message board for the partnership and the base camp as well.
Thanks, Liz. Awesome.
This is Heather. Just also want to point out that I put a link to get added to the SHIP listserv. So you would get some of this information via that route. If you're not already on it, go ahead and click the link and we'll make sure to get you added there.
Do partnership folks have additional questions for Sharina and Kara before we try to tackle some of those questions that were posed to us? Just any of those tangible pieces. Thank you for asking that, Jess. It's like, how do we get the money? If not, please stop anytime as you know things are percolating in your head. Maybe we can tackle that first question that Sharina had posed to this group. How have your agencies or coalitions have been involved in policymaking in the past? Timur, go ahead. I see your hand up.
Yes, hello everyone. Timur here from Slavic Community Center. Just kind of going back to those bills that passed. Is there any more information on the immigrant and refugee? What was it? A board that was put together, or a committee?
The Immigrant and Refugee Committee. Can you be a little more specific, Timur?
It was in the previous slide that shared.
Okay.
That was shared. Yeah, the Immigrant and Refugee SB 778.
Yeah, I think that's an office within the governor's office. And I haven't heard anything further. Kara, Sharina, I don't know if you might have.
I was just going to suggest, I appreciate that question, and we can try to find the answer if we know that it's been established yet and get that back out to the partnership.
Thank you.
Other questions? Other things that you're spotting?
Yeah, I have a quick question. This is Alicia. I guess one of my questions is, I guess it would be more for kind of later on when the funds are secured. Is there like a listserv or a main kind of information hub where grant opportunities are shared, or where community partners and and system partners can access that information? Or is it more like a, well, if you signed up for, you know, any one of our gazillion different listservs, you may be able to receive information about these grants? And then, like, how is it ensured that there is equitable access to, you know, to these applications?
So I think Kara put in the chat the link to Oregon Buys, and I think that's where you can find the information. And I know there's also a website on the Oregon Health Authority. Is that correct, Kara? Website?
I'll just say to answer your question, Alicia. So formally, all state agencies need to use that Oregon Buys website. And I recognize that it's not the most community friendly of the websites that we have, and it's a brand new platform that just launched at the beginning of July. So it's hard to kind of, we're still learning about it, but we're required to post any contract or grant in Oregon Buys. And then what we've done with this funding that we've been talking about that just released on Friday is we're not requiring that community-based organizations submit their proposals in Oregon Buys. There's a different, easier to use, hopefully, website where an application can be submitted or documents can be sent to apply, and that's just to try to bridge that somewhat. OHA also does typically put out a news release every time there's any new funding that's gone out. So there were some dollars that went out on the behavioral health side for Measure 110 a couple of weeks ago. That went out in a news release, and this public health funding will also go out in a news release later on today. But certainly if you have other folks that we should be sending things to, let us know.
Awesome, thank you.
This is Sharina. I'm just wondering if maybe, because I think we're probably running short on time, if maybe we could go to the next question around how would you as a partnership like to engage in OHA's legislative and rulemaking process? If anyone has any thoughts on that?
This is Stan. Oh, I'm sorry, Timmer's hand is up.
I think that his hand was up from the last one.
Yeah.
Go ahead and, yeah.
I'll go ahead and.
Why don't you go Stan, and then I see Ian has his hand up. So
Okay.
we'll go
Hey,
with
Ian.
Stan
How you
and then
doing?
Ian.
As I look at these next three questions, what I wonder, there be a place for the partnership to perhaps establish a policy legislative committee that could focus on this? It's a pretty big issue. We have our priorities, our strategies that we're working towards. Perhaps we could look at our strategies and our priorities and engage with the OHA positively, and how do we put legs to our priorities? What can we do as far as the legislative and rulemaking processes that might be a bit broad for the entire partnership to continually connect and work with? But if we could perhaps establish a committee for that purpose, is this something that could even be done with OHA? I understand OHA writes the legislative, the rules and laws and all that. But is that a way that we could perhaps positively engage, and then this new committee could report back to the partnership on a monthly basis and act and work with the partnership, so that it could be perhaps a partnership with the OHA? Anyway, just an idea.
So a legislative committee within the partnership, Stan, is that what we're hearing, that would work with our policy folks?
That's what I'm wondering. I don't know if that's within the parameters of the partnership or not, but I'm trying to think, how could a linkage be established here to help move this forward, to make things happen?
I think that's a fantastic idea. I think I would look to other, Kara, Christy, I don't know what, like you mentioned, the parameters, but I think that would be great.
If so, what steps would need to be taken? Are there parameters or outlines that we would have to follow? Are there rules or laws that would guide what we can say or what we can do?
This is Kara. Stan, I don't necessarily think so. Insofar as kind of beyond what Sharina shared, that for the Oregon health authorities, like legislative concepts or administrative rules, what we can do as an agency may look different than what you all, either as a group or individuals or associated with your organizations, may be able to do when it comes to policy. So I do think that having a committee to like kind of vet the opportunities and also potentially be connecting in with other agencies where we know that there are other intersections with health that are not necessarily like OHA scope could be really, really helpful to advance the work included in the plan.
Thanks, Kara. Stan, what I'd like to do is hold that thought on the potentially having the partnership have a legislative committee to work with our legislative team. Let's go ahead, and I think it's a great idea. Let's go ahead and get Ian and then Susan, and then we'll wrap this portion up and take our break. I know we have a lot more to cover today. So Ian and then Susan, please.
Hey all, apologies for being late at another meeting that ended at 12:30. I just wanted to ask, what existing relationships does OHA have staff, excuse me, does OHA staff have with legislators? In my modest experience in policymaking, I found that developing relationships with the policymakers themselves, particularly from a constituent to constituent basis, has been one of the most productive ways to engage in the policymaking process. I think one of the power that our group has is that we represent a diversity of constituencies around the state of Oregon. I'm going to plop something into the chat right now that goes into the current legislative committees in the Senate and the House, as well as the joint committees that exist. And I think that if we start exploring structure, one of the things that we don't negate, or that we shouldn't negate rather, is the opportunity that might be presented if we individually reached out to our policymakers that might serve on some of these committees at the Senate, the House, or the joint level. Because like I said, in my modest experience, I've found that when it's a constituent to constituent connection, and then we're having that higher level conversation about appropriations or about policy priorities, that there's a deeper connection there because we personalize it and we talk about the lens of, this is my experience as your constituent in the geography that you represent. So I don't know if we have existing relationships with legislators, I imagine that we do, but if we had kind of a targeted list of the key Senate, House, and joint committees, that might be a useful framework to be able to think about what our policy priorities are and how to be able to build on the existing relationships that OHA has with legislators.
Great, Ian. I think you've just been nominated as the new legislative committee lead.
I don't know if there's a thumbs down button, but I need to press that.
Yeah, oh, look at all the thumbs up. Look at all the thumbs up. Thank you, Ian. Good questions to have. So if we wrote those things down. I'm going to go to Susan. I don't know if Kara and Sharina, you wanted to answer Ian's question first, or is that more just food for thought for this group?
I'm staring at Kara here. I feel like she might be more qualified to answer. I think I'm not going to put my foot in my mouth, so I'm going to pass it to Kara if she has anything to say.
I mean, Ian, this is Kara. I think that you are right that relationships are so important, just like they're important to this group, and the work that we do with our communities, the same is reflected in the legislature. And in my experience with the investments that we have received over the last in the last session, that having our partners, OHA with partners or partners by themselves or what have you, actually participate in the process and speak to what the impact of an investment or a policy change could be is really important to making it happen. So appreciate your thinking about this, as well as maybe volunteering to have a role in it.
Great. Thank you, Kara. Susan, please.
So this is going to a little bit copycat or mimic or echo what Ian said, but it's probably not going to be as polished a delivery. The organizations that I work for works with several community coalition type organizations. And often when the legislator is having hearings on topics that they are particularly passionate about, like fundings for schools or fundings for childcare, things like that, they do send people to testify at the hearings. So I don't know where I sit on the idea of a committee per se, but maybe this group could be used as a communication central to make sure that as legislative items that come up that this group is passionate about, that we get that information out to our counterparts and our community organizations that we work for, so that people can be on point to go and speak to those topics at the legislator. Because it always seems like it's a last minute flurry to put together that small cohort of people who will go and testify. There's a 48-hour turnaround, and if there was a little bit more lead time, it might be a more effective effort.
Great, Susan. Excellent. Yeah, absolutely. I totally agree with you on just kind of the last minute scramble to find people. And if we already have a group of 20 potential folks from different parts of the state to help the cause or help speak on behalf of, I think is really excellent. So thank you for that. You know, this is a great conversation right now. I hate to stop it, but I'm going to. We want to make sure that folks get that quick break. So let's take five, or do we do 5 or 10 minutes, Christy?
I think 10 was
10, okay.
On the agenda.
So we're,
yeah,
so we're at 2:04. So how about we start back at 2:15?
Real quick note, I'm sorry, this is Heather.
Sorry.
Before we jump off, we still have folks here. Our interpreter was just wanting to get a check-in to see if there are folks here that would still need interpretation for Spanish after the break. Mark, would you like to give that announcement now, please? If you're still there. I don't know if we lost him.
Mark or Karina, would you want to do it?
Fantastic, thank you. If you could jump to the English channel. Hi, Mark.
I believe Karina was trying to do it. So let's give her the space to do that, and we will.
It sounds like Karina was doing it in Spanish on the Spanish channel or in English on the Spanish channel. It seems that maybe folks aren't logged all into the English channel. Just a reminder that folks do need to be on the English interpretation channel in order for our interpreters to be able to bounce over and have them hear their announcements. So just changing from off to English and interpretation. I heard them making the announcement and I heard you speaking as well. So I think we're just bounced around a bit. Are you ready for the announcement, New?
I think so. Let's do the announcement. Go ahead. Great. Thank you, Karina. Let's go ahead and resume at We're running short on time. Is everybody okay with a 5-minute break? Is that too short, or do we really need to take 10? I see some thumbs up. So let's resume. Let's go ahead and gather back. The next piece on our agenda is we're going to review the prioritized strategies. At this time, what we want to do is reach consensus on the focus for the strategies for 2022. Now, remember, these are the ones that the guidance committee are putting forward to you folks as a whole committee. What we want to do is share these with you. I don't know, were we going to give them a little bit of information on this as well, Christy? Were you going to share anything?
The additional details have been included in the packet.
Yeah.
So I'm hoping people have had a chance to review this ahead of time. I think maybe if there's any questions that people have, if not, we could launch the poll and see where people are at.
Yeah. Do folks need a second to just kind of do a quick review for themselves prior to us going right into getting a feel for whether you folks want to move to consensus that this indeed is where we want to go? We'll give you a couple minutes just to look through it.
Maybe just to remind everybody what happened. We've been having this conversation about what strategies to focus on for a few months now. And I think especially the conversation that we were just having around legislative policies is a really great example of what could happen once we have a focus of particular strategies that you all want to get started on. So just a reminder about process, there were a couple of rounds of surveys that you all took and responded to that asked you to identify of the 62 strategies, which ones were most important, which ones were least important. We then moved the strategies that were rising to the top from those survey efforts into a Jamboard that you all looked at over a series of meetings as well and discussed and moved a few things around. That brought us to 15 strategies that you looked at in November. And then from there, the guidance committee pulled out these 7 from that list of 15. And the additional information in the meeting materials gives you a little bit of sense of where the originating priorities were related to those strategies, some of the data that we were looking at and monitoring related to those strategies, intersections with other state agencies and other strategic plans in terms of alignment and areas that we would potentially leverage for advancement, and then some additional rationale, particularly things related to COVID and other pieces of information that we felt were helpful in terms of justifying why these strategies were most important. I think the only other thing to add is that this is just a starting place, right? I think, again, we're doing this very differently than we have in the past. And I think, this is just a way to kind of get started and to kind of see what happens, to kind of experiment a little bit with what it means to start to advance these strategies. And it doesn't mean that, other strategies can't be folded in as you get moving on these.
Right. So let's go ahead and take our first poll and see how the partnership members feel. If you're a voting member, we would ask you to vote either thumbs up, you agree, thumbs down, I disagree, and thumbs sideways is I have a question, comment, or I need more information. Okay. So how do you feel about the current proposal? And the proposal is to accept these 7 as the strategies moving forward for year 2022 for next year. So these would be the things that we would focus on as the full partnership in 2022. So thumbs up, thumbs down, or thumbs sideways. And for thumbs sideways, we will give opportunity for folks to actually ask their question or comment or get more information. So go ahead and take the poll. You should have it. It should be popping up on your screen right now, and then you select one and then press submit. And I would ask that if you are not a voting member of the partnership, that you do not participate in the poll. And just as a reminder, Heather has put in the chat the link to closed captioning that's available to folks.
All right. Are you ready to see where we're at?
Yeah, let's do that.
Okay.
Looks like there's 70% with thumbs up, thumb sideways is 30%. So I would ask at this time, for those of you who had thumb sideways, what questions or things do you want to bring up? What type of information do you need at this time? So the floor is yours, so please.
This is Steve at Hillsborough Medical Center, and my question is, I see 2 of the bullets regard the food system and 3 regarding behavioral health. Are these, if we're voting on a list, are these duplicates, or would we do one of the 3, for example, or where are we headed? I'm just not clear on that piece.
Steve, thank you for your question and observation. I don't believe right now, I mean, for your question as a non-voting member of the partnership, I know you're part of our public crew that is here today. Your question is that part of it is we would accept these priorities moving forward for 2022. This group of voting members would determine, not necessarily, we could do many of these things at the same time. So it's not necessarily putting one of them at the top as opposed to the others, but this would be a collective group that we would move forward in the next year for work.
Got it. Thank you.
Thank you. So for those of you who are voting members on the partnership, what other questions do you have? Or concerns, comments? Ian?
Yeah, thanks so much to the group for prioritizing the strategies and just going through layers of engagement. My question is about bullets 2 and 3. There looks to be an opportunity to maybe drop one, or perhaps I could get some more clarification. To me, having 3 reduces the importance of number 2. But again, I see the value of both of them. I just see that for me, I would drop number 3 in favor for number 2 exclusively to be able to have greater focus. But maybe what I need to understand here is that having multiple priorities in the same domain may be a feature, not a bug, and enhance our capacity to complete both of them. But yeah, to me, having a more kind of narrow focus on a single priority in an area would be of greater value than having diffuse priorities in the same area. But yeah, I wasn't part of this conversation. So maybe if I could have just a greater degree of clarity on specifically around the food systems work, why we included one which prioritizes people of color and low-income communities, and a second that prioritizes all communities.
This is Alicia. Can I reply to that one?
Please.
So, great question, and so I think the way the thought process here was that we looked at the state health assessments and then the community feedback, and we took essentially kind of like the top 5, 6, or top 7 kind of needs that were presented consistently throughout the different reports that we had available to us. Now, one, and I understand the the desire to focus on only a particular group in terms of food security. The issue that that does create is that it actually, in a way, eliminates people in rural areas, which we know are very vulnerable to food security. The idea of, because of the fact that the way that people of color are generally distributed in Oregon are that they are generally in the city, or in kind of urban areas compared to the rural areas. Now, this will allow us to focus on food security itself, and at the same time, essentially target two different vulnerable populations. So we have the rural population, which isn't necessarily always, people of color, but we also out here in rural areas have very, at times, very different culturally, cultural interpretations of our foods. And then we also have the people of color in urban areas. So that was the thought process behind that, so that we can focus on two vulnerable populations and target populations that are already listed in the H2O. But this is one of the only ways to do it without completely eliminating or kind of forgetting about the rural area.
Thanks, Alicia.
I can also kind of chime in with a little bit more context for this too. So they do also target different activities. And I just wanted to kind of mention that a lot of the increasing access to affordable, healthy, and culturally appropriate foods for people of color and low income communities, that's a lot focused on like the access, the available programs, how can people actually access support services that are in their area. We know, before COVID, through COVID now, food security is just such a huge issue for everyone across the board, as Alicia mentioned. And then the building a resilient food system is actually a little bit broader than that. And so it includes things like climate change, it includes things like emergency planning, right? And so it's kind of broad, and also includes work directly with farmers. So it's a little bit less about access and more about like the system itself. And I can give you, we're starting this work where we've begun discussions with the major food policy council in Oregon, which is Oregon Community Food Systems Network. And we just have recently started those discussions around a grant opportunity nationally that's come up. So we're trying to bring some resources to that work, and that's specifically going to be a pass-through grant, which will enable us to work within the building a resilient food system. And that's would be working like potentially directly with tribes, it'd be working potentially directly with Black and Brown farmers, and then also with that network as a whole, who is in this transition phase where they've been doing all this great work for years, and now they're finally becoming their own 501c3, and they're becoming and they're starting to staff up and getting resources for staffing too. And I know that later on Connie is going to give a report out from the Oregon Community Food Systems fall convening, which she was able to attend. But I also just wanted to kind of give a little bit more context too, in the fact that they seem very similar, but they actually kind of are a little bit different and nuanced in the different kind of activities that would fall underneath each of those strategies.
Thanks, Liz.
Thank you, Liz. Other questions? We don't have a whole heap of time to go through more because I know we have a tight agenda, but we can continue to focus on this if folks still have additional questions. Talk, I see you have your hand up. Go ahead.
Yeah, so I realize that we don't have time, so.
No, please.
Thank you, Alicia and Liz, for your explanation. I'm wondering if that might be the same or a similar response to my question, which is similar to Ian's. When I look at the behavioral health bullets, the three, I need clarity on, like, for example, when we talk about reduced systemic barriers, to me, culture and language, transportation, that is included in systemic barriers, and the list goes on, right? And then if you look at provide culturally and linguistically responsive, trauma-informed, multi-tiered, I feel like there's some overlap, and I guess I need clarity on what we specifically mean. Like when we say multi-tiered, what is that? And then is it really like improve integration between behavioral health and other types of care? Like that's really broad as well. So the behavioral health ones for me, like do a dance, but I don't quite know the flow of the dance.
Yeah, yes. Talk and thank you. It's so pretty much same concept for the behavioral health pieces. Now, let me go to the reduced systemic barriers. From my understanding, that particular one is very systemic. So it's kind of going back to the overall system, how the system is, I'm sorry, how the system itself is kind of, or conducts services, right? And the way that it's presented to, or the way that services are accessible services to the community. And from my understanding, that includes things like being able to just hire new people within or hire mental health professionals, because there is such a shortage, for mental health professionals just overall in Oregon, and then also again in inner cities and rural areas. The providing cultural and linguistically responsive, trauma-informed, multi-tiered behavioral health services that supports to all children and families. That is more in line of, so for example, there are peer-delivered services. Certain peer-delivered services aren't necessarily accessible or culturally and linguistically responsive, but they do connect with behavioral health. Now, from my own experience, for example, when we take wraparound into consideration, in the county that I live, only in families who are in wraparound services are able to receive certain peer-delivered services, such as a family partner or a youth partner, right? So that makes it very difficult for other families who don't qualify for wraparound services, but could utilize peer-delivered services. And that's a multi-tier kind of step here. And then the other piece where improve integration between behavioral health and other types of care is more in terms of things like behavioral health, or a youth who accesses behavioral health services and DD services, right? So those two, there is this kind of, I don't know, fight or whatever between the two, where, one of them, one of them, it says, yeah, that's our domain, we can't touch it. And then there's just this, if they were more integrated and collaborated, it would be more effective and efficient. And I guess that's the idea behind that particular piece. But again, and these are just examples and kind of examples from my own experience. I'm pretty sure Liz and Christy might know much more about kind of more detailed responses here. Um, but that is where the problem lies, is that while they are all interconnected, they cannot be all addressed with the same strategy. And I think that is one of the big issues that we've had in identifying prioritize strategies.
Yeah, and Christy dropped something in the chat just around the behavioral health services for children. And so take a look at that too. Again, it was in conjunction with working with Department of Ed and Oregon Youth Authority. Susan, you have your hand up? Or is
I
that from-
do, thank you. I just was having trouble unmuting. So I actually really agree with that description that you just provided, because you know, there is always going to be that kind of tension of scope between different aspects of different community services. And I know that you were seeking feedback from people who were a little on the fence with our priorities, but I've actually really come to appreciate how we teased out that definition so that we covered those areas of scope. You know, we're not just making a blanket statement about food security. We are actually teasing out where the areas of food security that need to be addressed are, and behavioral health. And so I just kind of wanted to put my 2 cents in that I really agree with how that definition is being addressed here and described. And I think it's a valid piece of description to get that granular on how we need to address different areas.
Oh, thank you, Susan. Thanks for that. I want to pause for a second and give folks an opportunity to kind of think about whether they want to have a little more discussion, have more questions to help them navigate where we're at. Also thinking that, reminding folks that this is the potential to do work for 1 year, right? This isn't everything. This is moving forward. You know, this could end up getting pared down to 3 bullets or even 4 and not all 7. And so this was a starting point that the guidance committee had come up with and wanted to move forward for the next year. There will be more work that can happen at the same time. But as a starting point for 2022, let's take the vote one more time and see where folks land. And does that sound good? Or do folks want to process a little more?
Could I add something real quick before we vote?
Sure.
That so one of the conversation that we also had in the guidance committee is that when we talked about these different strategies, we could kind of see how they're all interconnected. However, at the same time, we could also see a path to how each one of those strategies can lead to the next strategy that we need to address. So, for example, the one that Christy had talked about or dropped in the chat about the multi-tiered behavioral health services, we know that there are education related strategies that were identified in the H2O. So we kind of saw how when we talked about these different things that could happen that we work on, we saw the kind of the how they extracted different or other or additional strategies that could be worked on in the next year. So I don't know if that makes any sense in terms of how I just explained it, because that was totally clunky, but I hope yeah, I hope it makes sense.
Thanks, Alicia. Let's move to another vote, Christy.
Yeah, New, before we do that, I just want to confirm that we've got a quorum. And I just want to confirm that Kurt is still on the phone.
I am.
Okay, fabulous. You come up as a phone number, so I just wanted to make sure that we had the number that we need, and we do. So.
And Kurt, are you able to actually see the poll?
I'm not, but I'm
Oh,
a
you're not.
thumbs up.
Okay, thank you. Thank you for that. I wanted to make sure we got your membership vote. All right, so let's go ahead and go one more time and see where we land as a group, if we've reached where we're at. So thumbs up, agree, thumbs down, disagree, thumb sideways. I have concerns or questions or comments.
Yeah, sorry, New, I was trying to bring up the Zoom poll, but it's not letting me do that. So maybe we can just.
Okay, let's go ahead and do it visually then. So, or within the chat. Ian, I see you. Connie, I see you. Stan, I see you. Yes, talk. Jess, good. Timur, thank you. Esther, I see you. Jess, I see you. I believe we are at, I have seen everyone on the roster, and I believe we are at thumbs up. I did not see any thumb sideways, which is what I was looking for. And I don't know that you can actually do a thumb sideways. I apologize now that I think about it. Well, that was easy. We should always vote like that. Would anybody like to out themselves and ask any more questions? I apologize for that inconvenience and that this method that's not as great. Okay, so thank you everyone for just taking time. It looks like we've come to a majority consensus on moving forward with these priorities and strategies. Thank you for processing a little more with folks, and thank you Guidance Committee for furthering that work. I know we don't have a lot of more time to look at the work plan for the next year, and we do have a potential time to give to Connie to give on the conference she attended. Do folks have a preference? I feel like we could probably end really well with Connie giving her update and then doing some of that development work as we process a little bit more and possibly do some of that committee work and send that out via email. I mean, you all have it right here. Christy, do you have a sense of what you'd like to?
Yeah, I do want to just take a few moments to visit the committee work.
Okay, let's do that.
I think it carries forward some of the ideas that were raised in the first part of the meeting around the legislative committee. I know two things that I heard come out of that conversation was one, some interest in forming some sort of policy committee, which I think is super exciting. And sorry, I'm having like crazy allergies today. The second piece was around communications, right? And we hearing from you all about how OHA can do a better job of communicating with community, not only about funding opportunities, but about all of these things. So there are a number of committees that I think, you know, a need for committees or other work groups that have come up. The Funding and Finance Committee was something that was brought forth earlier this summer, and there was a lot of interest. At that time, we decided to kind of pause on that to formally get your charter together and get the Guidance Committee together, but wanted to bring that up as a potential as well. There is a need to get a Funding and Finance Committee together to help determine how you want to allocate some money that we have in our CDC block grant to support this work. So you can see that is kind of proposed here. If there are people that are interested, the Communications Committee can not only help to understand the variety of partner networks that you all have connections with. So maybe doing some mapping, but also helping to inform how OHA is communicating about this work with partners across the state. Community engagement and measurement and data, those are two things we haven't even brought up yet. A policy committee was mentioned today. So just wanted to get a sense of how people are feeling about potentially launching additional committees. You know, if you have time, if you have capacity, how that would work. I think the other consideration that we just want to offer from OHA's perspective is that we probably don't have the staff to support all of these groups getting launched right now. And that's hopefully something that we can better support as we get going next year and kind of get staffed in a post-COVID world. But would love to hear your interest around standing up some of these other committees right now.
I wasn't here earlier, apologize for being late to this meeting today, but I'm curious to know what ideas came up specifically around the policy committee. Was it thinking about implementation, like how this can be implemented in policies? Is it talking about how to advocate like during the upcoming legislative sessions? You know, I would be really curious to see. I would be curious to hear those conversations and yeah.
Yeah, Esther, thank you for that. And really, it was brought up that this body, the partnership, could be used in several different ways as not only a source of potential constituents to communicate to the legislature about various issues, right? So our key legislative policy folks that OHA can pull from this group. It could also be that we've heard, can this particular group, a committee, a legislative committee within the partnership, along with this other list of committees that Christy has put forward here, could there be a legislative committee that works to share about the rules and the guidelines that are happening, and again be another force for sharing information to community, and then also to look at where legislative potential legislative policies are being developed, and this group would be a way to kind of communicate back and forth. And so there's a lot of opportunity. So that's what was coming up for folks, for a handful of folks.
Thanks for that.
Yeah. I'm wondering if it would be helpful, and I apologize for not giving this enough time today. We really had some really good, robust conversations early in the piece on the legislative concepts and whatnot. I wonder if this could be done where we offer up the same list and maybe give folks the opportunity to sign up, ask more questions, you know, do some homework, because everybody wants homework during the holiday season. So I'm not sure how we want to move forward with this. If folks have any thoughts and how they want to engage in whether more committee work, for those of you who look at this list and say, how am I going to do it? What are your thoughts around this?
Maybe that's something we could discuss at the retreat in January, and then bring it back to the wider group in February, or we could just put it on the agenda for February.
Yeah.
I'm hoping that after the holidays and New Year, everybody's refreshed.
Mhm.
Maybe get more new ideas to the table. And
Yeah.
I think we might just be a little tired.
Yeah. Rest is a
Oh,
good
I
thing. Yeah. And I apologize for giving you homework over the holidays. That's the teacher in me. There was a question of Ian in the chat asking about what's the sense of how many committees can OHA support? So that's a good logistical question. How many can we possibly support? So we don't have an answer for that right now, Ian. It's a really good question, but we hope to figure some of that out and gain for the OHA team to gain some more support over the next year to do this work where folks aren't spread so thin in having to attend all the committee meetings to support you all. And so we'll hopefully have more information on that.
Yeah, I think the only thing I would add from OHA's perspective, just in terms of if we had to prioritize these, I would say that the policy committee would be important, just given the timing of the conversations that will be happening now. And then the funding and finance committee, just to help us make some determinations about the block grant. So maybe there's like two options. If you are interested in either a policy or a funding committee, you could email me and let me know. And that would be like an action that would be great if you could respond by the end of the year. And then another thing that we could offer potentially is to, instead of a meeting in January, we could host like an open office hours. If people just wanted to touch base and say hi, if you have questions about anything or just want to chat about anything HTO related, including additional committees. So if you have questions or potential interest, but want a little bit more information or to share other ideas that you have, we could offer that for you as well, if it would be helpful.
Yeah, I was also wondering if maybe we can combine the committees. So, because we have the guidance committee right now, then we could potentially do the funding and finance with the measurement and data committee, and then the community engagement committee with the communications committee. So that would put it down to 3 different committees in addition to the policy one. Or another option would be to have policy and community or communications committee or policy and community engagement committee. In any of those combinations, but I think it would probably be easier to determine if we knew how many people are interested in sitting on a subcommittee, and then where the interest lies, and then also where is the need. And I think Christy, you had mentioned it's definitely policy and then funding for sure. So like I said, maybe we can combine some of these, and then because again, a lot of these seem to be in a kind of interconnected and related. Just an idea.
Thank you for that, Alicia. Let's do this. In keeping in accordance with people's time and giving folks some time to think about what do I actually have time for or interest in. If you can shoot Christy an email before the end of the year, and let her know which one of these you would be interested in participating in. And the only thing that's not on this list is that newly the legislative/policy committee. So if any of those things interest you, please either shoot Christy or myself an email and saying, these are the things that I have an interest in. That's it. Right. And that I don't think we need to go further into that. And then we'll take that to the guidance committee and see where we can kind of further combined or, prioritize which ones we have the capacity for. So if that works for everybody, that will be the to-do. Look at this list, determine what your availability and interest are, and shoot Christy or myself an email, and we will do some of the follow-up with the guidance committee for that. I know we have about 5 minutes left. What I'd like to do is, before Connie gives her quick update on her attendance to the conference, we want to remind folks that we are not going to have a January meeting, and we will be having our first meeting of 2022 on February 7th. Same time, same channel. So with that, Connie, I'm going to give you, I apologize that I didn't give you more time, but you want to give your update about the conference that you attended? I know there was a lot of good information.
There was a lot of good information, and Liz she did a great segue into it. And what I'm going to do, because I went through some of these emails and they weren't in existence. So what I'm going to do is circle back and try to go to like the Seed Exchange or Oregon State Extension. They have a catalog, and I would have more information at the February meeting.
Okay.
I started on it before, and it's like, well, this doesn't even exist. And some of them are talking about before COVID, during COVID, after COVID. So I just want to make sure I'm not giving out bad information. But basically what it was about is how to be sustainable as far as planting your own plants. And I had suggested about some communities starting a community garden, and there are funds available for that. And I will, like I said, I'll have more to talk about in February, because I want to make sure that everybody has a clear understanding of what I would like to see happen. And if they're on board, they would take it to some of their community members.
Great. Thank you, Connie. Thank you for being gracious with the time to, I apologize for getting bumped into your time to share all of the things that you learned. At this time, we have 3 minutes left. Do folks have any additional pieces that they wanted to share with guidance committee, Christy, myself, or other OHA staff, or with one another?
No. Happy holidays to everybody.
Yes, thank you. And, you know, it's been such a pleasure working with all of you this past year, and I know many of you feel the same sentiments. And so we encourage you to get that rest and recuperation in the weeks to come and for the month of January. And thank you for those of you who will be continuing to help guide the work in 2022. We're really excited and really just grateful to be working with such a powerful group in what you bring and what you share and the hard work that you're bringing to this group.
Thank you so much.
Thank you for your guidance.
Thank you, New.
Yeah, thanks, New. Thank you for facilitating us.
Yeah.
Yeah, thank you.
Thanks, everyone.
Thank you, everyone. Be safe out there. Take good care.
You too, all of you.
Everyone, have a good New Year.
See you in January, Susan.
Merry
Looking
Christmas,
forward
happy
to it.
holidays, everybody.
Thank you all.
Yeah.
You don't want to start singing, do you?
My apologies, Connie, that we just didn't have very much time there towards the end.
Well, it was good that Liz did bring it up. That was good. So we got to at least get a taste of it. Like I said, I have to circle back to some of these, and I have to get some more names and stuff. But maybe I'll put it out there, and we can put it up on a screenshot or something.
Yeah.
Yeah.
Connie is going to be so helpful, especially now that we've gotten to consensus about these strategies moving forward. It's going to be super helpful information over the year to come. So,
well, you know, I did talk to somebody in my community, and they kind of, I don't know how to get them interested in it, because everybody's like poo-poos it. Well, I'm not going to do all this work, and I'm not going to do all that. Well, they hadn't even heard what my goal was, and they just said, nope, don't want to do it. And so I'm probably going to go back and see if we can try again. I think that if you can get enough grant money, we could probably get the master gardeners to help, something like that. But we have to get interested in, as things change and food is going up, 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 we have to learn how to take care of ourselves.
Yeah. Thank you, Christy. We'll catch up soon. I know you have to go.
I gotta go get my kiddo.
Yeah,
Thank
go.
you so much, Connie. Happy
Thank
holidays.
you to our,
Okay,
thank you to
see you
our
soon.
captioner.
Happy holiday.
Kurt, are you still
Yes,
there?
thank you.
Oh, there
Thank
was
you,
somebody on
Heather.
the phone.
Bye.
Thank you, Connie. Thank you, Heather.
Hi,
Thank you,
everyone.
Lou.
Thank
Don't
you.
drink too much eggnog.
That's not in my repertoire.
Oh, but I have a good one. I have a hot
Oh,
toddy
really?
apple cider. Oh man, is it good?
That sounds like I need that recipe. All right,
Okay,
be
I'll give it to you
safe.
right now. Here it is.
Okay.
It's 1 jigger of whiskey. I
Mhm.
used the instant apple cider, a lemon, some honey, and a cinnamon stick. And you heat the water up. You put the apple cider, the packet of apple cider in.
Mhm.
Add your whiskey, a piece of lemon,
Mhm.
some honey, and a
Honey.
cinnamon stick. Have it all heated up, and boy, you're ready to go.
Okay.
All right.
Got it.
Let me know. Let me know if you like it.
Oh, I will.
Okay.
Take care.
Take
Bye,
care.
everybody.
You too. Bye bye.